Hello everyone, welcome to our channel Canadian Nurse Expert. The human immune system is a complex network of cells, tissues, and organs. It defends the body against harmful invaders such as bacteria, viruses, fungi, and parasites. Understanding this system is crucial for aspiring healthcare professionals, especially those preparing for the NCLEX-RN exam. This guide provides an overview of the immune system, focusing on its interaction with HIV. HIV, or the human immunodeficiency virus, poses a significant global health challenge. It attacks the immune system, making individuals more susceptible to infections and certain cancers. For nurses, understanding HIV is paramount. They play a vital role in patient education, medication administration, and providing compassionate care to those living with the virus. The immune system is a powerful defense force protecting us from pathogens. It is categorized into two main branches: innate immunity and adaptive immunity. Innate immunity is present from birth and serves as our initial line of defense. This arm of the immune system includes physical barriers, chemical defenses, and specialized cells. Our skin acts as a formidable physical barrier, preventing the entry of many pathogens. Mucous membranes trap and expel microbes, acting as another crucial line of defense. Innate immunity deploys chemical weapons to combat invaders. Tears and saliva contain enzymes like lysozyme that break down bacterial cell walls. The acidic environment of our stomach acts as a potent barrier against ingested pathogens. Specialized cells patrol the body, seeking out and destroying pathogens. Phagocytes, such as neutrophils and macrophages, engulf and digest invading microbes. Natural killer cells destroy infected cells by releasing cytotoxic granules. Adaptive immunity represents a specialized and targeted arm of the immune system. It develops over time through exposure to specific antigens. Adaptive immunity remembers previous encounters with specific antigens, allowing for a faster response upon subsequent exposures. This immunological memory is the foundation of long-term immunity and the principle behind vaccination. Two key players in adaptive immunity are B cells and T cells. B cells mature in the bone marrow and are responsible for humoral immunity, producing antibodies. Antibodies bind to specific antigens, marking them for destruction or neutralizing their ability to infect cells. T cells mature in the thymus gland and are responsible for cell-mediated immunity. Cytotoxic T cells kill infected cells, while helper T cells activate other immune cells. Together, B cells and T cells orchestrate a highly specific and effective immune response. B cells, originating in the bone marrow, are essential components of the adaptive immune system. They are responsible for humoral immunity, producing antibodies. These antibodies recognize and bind to specific antigens, tagging pathogens for destruction. B cells undergo a maturation process in the bone marrow. Each B cell generates a unique receptor capable of recognizing a specific antigen. This diversity ensures our immune system can handle a vast array of threats. Upon encountering their target antigen, B cells become activated. This activation leads to the proliferation and differentiation of B cells into plasma cells and memory B cells. Plasma cells produce vast quantities of antibodies. These antibodies circulate throughout the body, marking pathogens for destruction or neutralizing their ability to infect cells. This targeted approach is a hallmark of humoral immunity. T cells, maturing in the thymus gland, are crucial components of the adaptive immune system. T cells combat intracellular threats through cell-mediated immunity. T cells possess unique receptors called T cell receptors, TCRs. These receptors recognize antigens presented by major histocompatibility complex molecules. This ensures T cells can distinguish between healthy cells and those harboring pathogens. There are two main types of T cells: helper T cells, CD4 plus T cells, and cytotoxic T cells, CD8 plus T cells. Helper T cells play a supportive role in the immune response. They release cytokines that orchestrate and amplify the immune response. Cytotoxic T cells are the executioners of the immune system. They recognize antigens presented by MHC class I molecules. Cytotoxic T cells release enzymes that induce apoptosis in infected cells. This targeted killing eliminates the pathogen while minimizing damage to healthy tissues. T cells are essential for a robust and balanced immune response. B cells and T cells rarely act in isolation. They engage in a coordinated and synergistic dance, amplifying each other's efforts. This interplay is crucial for a robust immune response. Helper T cells activate B cells by releasing cytokines. This activation is crucial for a strong antibody response. B cells can also present antigens to T cells, enhancing T cell activation. This bidirectional communication ensures both arms of the adaptive immune system work in concert. The interplay between B cells and T cells highlights the complexity of the immune system. This collaboration ensures a highly specific and targeted immune response. The immune system effectively combats pathogens while minimizing damage to the body's tissues. HIV is a retrovirus that targets CD4 plus T cells, crucial for orchestrating the immune response. By infecting and destroying these cells, HIV weakens the body's ability to fight infections and certain cancers. Understanding how HIV targets CD4 plus T cells is fundamental to comprehending its impact on the immune system. CD4 plus T cells have a receptor molecule called CD4, which HIV uses to gain entry into the cell. HIV also requires a co-receptor, typically CCR5 or CXCR4, to fuse with the cell membrane. This dual receptor requirement explains why certain individuals with genetic mutations affecting these co-receptors exhibit resistance to HIV infection. Once inside a CD4 plus T cell, HIV hijacks the cell's machinery to replicate itself. This replication leads to the destruction of the infected T cell. As more CD4 plus T cells are destroyed, the immune system becomes weaker. This leaves the individual vulnerable to opportunistic infections. HIV's impact on the immune system is devastating. Understanding HIV's mechanisms is crucial for developing effective treatments. The HIV life cycle begins with the attachment of the virus to a host cell and ends with the release of new viral particles. Understanding this life cycle is crucial for developing effective antiretroviral therapies. The first step is the attachment of the virus to a CD4 plus T cell. This attachment is mediated by viral envelope glycoproteins, GP120 and GP41. These glycoproteins bind to the CD4 receptor and a co-receptor, typically CCR5 or CXCR4. This interaction triggers a conformational change in the viral envelope, facilitating fusion with the cell membrane. Following fusion, the viral RNA and proteins are released into the host cell's cytoplasm. Reverse transcriptase converts the viral RNA into double-stranded DNA. This viral DNA is integrated into the host cell's DNA with the help of integrase. The integrated viral DNA, or provirus, can remain dormant for years. When activated, the provirus hijacks the host cell's machinery to produce new viral RNA and proteins. The hallmark of HIV infection is the progressive depletion of CD4 plus T cells. This depletion leaves individuals susceptible to opportunistic infections and certain cancers. HIV replicates within CD4 plus T cells, leading to their destruction. Infected T cells can be killed by the virus or by the immune system's cytotoxic T cells. HIV infection triggers chronic immune activation and inflammation. This chronic activation leads to immune exhaustion, reducing the effectiveness of remaining T cells. The rate of CD4 plus T cell decline varies among individuals. Factors such as age, health, genetics, and access to antiretroviral therapy influence disease progression. Without treatment, HIV infection progresses to AIDS, the most advanced stage. HIV infection progresses through distinct clinical stages. Understanding these stages is crucial for healthcare providers. Early diagnosis and treatment are paramount in managing HIV infection. The first stage, acute HIV infection, occurs within 2 to 4 weeks of exposure. The virus replicates rapidly, leading to a surge in viral load and a temporary decline in CD4 plus T cell counts. Many individuals experience flu-like symptoms. As the immune system responds, viral load levels may decrease, and CD4 plus T cell counts may partially recover. This marks the transition to chronic HIV infection. This stage can last for several years with minimal symptoms. Even during this phase, HIV continues to replicate and damage the immune system. Regular monitoring of CD4 plus T cell counts and viral load levels is essential. Early initiation of antiretroviral therapy during chronic infection is crucial for suppressing viral replication and preserving immune function. Without treatment, HIV progresses to AIDS. AIDS is defined by a CD4 plus T cell count below 200 cells per cubic millimeter, or the presence of certain opportunistic infections and cancers. Opportunistic infections take advantage of the weakened immune system. These infections can cause serious illness and affect various organ systems. Common opportunistic infections include pneumocystis jirovecii pneumonia and Kaposi's sarcoma. Other infections include toxoplasmosis, cytomegalovirus retinitis, and Mycobacterium avium complex. The specific infections depend on geographic location, previous exposures, and overall health. The diagnosis of AIDS signifies a critical decline in immune function. Effective antiretroviral therapy has dramatically improved the prognosis for people with HIV. Early diagnosis, consistent RT adherence, and regular medical care can prolong survival and improve quality of life. The landscape of HIV management underwent a paradigm shift with the advent of antiretroviral therapy, or ART. No longer a death sentence, HIV infection with the aid of ART has transitioned into a manageable chronic condition for many. This remarkable transformation underscores the power of scientific innovation and the importance of accessible healthcare in combating global pandemics. RT encompasses a combination of antiretroviral drugs that target different stages of the HIV life cycle. By interfering with viral replication at multiple points, RT effectively suppresses viral load, preventing further damage to the immune system. This suppression not only improves the individual's overall health and well-being, but also significantly reduces the risk of transmitting the virus to others. The primary goals of ART are multifaceted and extend beyond simply suppressing viral replication. They include maximizing and preserving immune function. By protecting CD4+ T cells from destruction, RT allows the immune system to rebuild itself, restoring its ability to fight off infections and preventing the progression to AIDS. ART also aims to improve quality of life. ART has transformed the lives of countless individuals living with HIV, enabling them to lead longer, healthier, and more fulfilling lives free from the debilitating effects of opportunistic infections. Reducing HIV-related morbidity and mortality is another key goal. ART has dramatically reduced the incidence of opportunistic infections and AIDS-related deaths, turning what was once a fatal diagnosis into a manageable chronic condition. Finally, preventing HIV transmission is crucial. RT plays a crucial role in public health by reducing the risk of HIV transmission. When taken consistently as prescribed, RT can suppress viral load to undetectable levels, making it virtually impossible to transmit the virus sexually. ART typically involves a combination of at least 3 antiretroviral drugs from different drug classes. This multi-drug approach, known as highly active antiretroviral therapy, or HART, is more effective than using a single drug because it targets multiple steps in the HIV life cycle, making it more difficult for the virus to develop resistance. The different classes of antiretroviral drugs work by interfering with specific viral enzymes or proteins essential for HIV replication. Some of the major classes of ART drugs include nucleoside or nucleotide reverse transcriptase inhibitors, or NRTIs. These drugs mimic the building blocks of DNA and are incorporated into the growing viral DNA chain during reverse transcription. However, because they lack the necessary chemical structure, they act as chain terminators, effectively halting viral DNA synthesis. Examples of NRTIs include zidovudine, tenofovir, and emtricitabine. Non-nucleoside reverse transcriptase inhibitors, or NNRTIs, are another class. Unlike NRTIs bind directly to the reverse transcriptase enzyme, preventing it from converting viral RNA into DNA. Examples of NNRTIs include efavirenz, nevirapine, and rilpivirine. Protease inhibitors, or PIs, are also crucial. HIV protease is an enzyme responsible for cleaving newly synthesized viral proteins into their functional forms. PIs block this cleavage process, resulting in the production of immature and non-functional viral proteins, effectively preventing the assembly of new viral particles. Examples of PIs include ritonavir, darunavir, and atazanavir. While RT has revolutionized HIV management, its effectiveness hinges on one crucial factor: adherence. Adherence refers to the extent to which a patient takes their medication as prescribed by their healthcare provider. Consistent and correct adherence to ART is paramount for achieving and maintaining viral suppression, preventing drug resistance, and improving long-term health outcomes. When ART is taken inconsistently or incorrectly, it gives HIV an opportunity to replicate and mutate, potentially leading to the emergence of drug-resistant strains. Drug resistance occurs when HIV develops mutations that render it less susceptible to the effects of antiretroviral drugs. This can compromise the effectiveness of current and future treatment options, making it more challenging to manage the infection. Several factors can influence ART adherence, including pill burden and dosing frequency. Some ART regimens involve taking multiple pills throughout the day, which can be challenging for some individuals to manage. Side effects. Antiretroviral drugs can cause a range of side effects, some of which can be unpleasant or difficult to tolerate. These side effects can discourage patients from taking their medication as prescribed. Mental health issues such as depression, anxiety, and other mental health conditions can interfere with a patient's ability to adhere to their medication regimen. Substance use, such as alcohol or drug abuse, can also impact medication adherence. Additionally, HIV-related stigma and discrimination can prevent individuals from seeking care, disclosing their status, and adhering to treatment. Perinatal HIV transmission, or mother-to-child transmission, occurs when HIV is passed from a pregnant woman living with HIV to her child during pregnancy, labor, delivery, or breastfeeding. This transmission route poses a significant threat to global public health, particularly in resource-limited settings where access to prevention and treatment services may be limited. Fortunately, significant strides have been made in reducing perinatal HIV transmission rates. The implementation of comprehensive prevention programs, including universal HIV testing for pregnant women, the use of antiretroviral therapy during pregnancy and breastfeeding, and safe infant feeding practices, has dramatically reduced the incidence of mother-to-child transmission in many parts of the world. ART plays a pivotal role in preventing perinatal HIV transmission. When taken consistently as prescribed by a healthcare provider, ART effectively suppresses viral load in the mother's blood, reducing the risk of transmission to the baby during pregnancy and delivery. For women living with HIV who are planning to become pregnant, early initiation of ART is crucial for both their own health and the well-being of their future child. In addition to ART, other measures are taken to minimize the risk of mother-to-child transmission during labor and delivery. These include opting for a cesarean section delivery in certain cases, avoiding procedures that could increase the risk of exposure to the baby's blood, such as artificial rupture of membranes, and administering ART to the infant shortly after birth. These interventions, combined with ongoing medical care and monitoring, significantly reduce the likelihood of perinatal HIV transmission. Post-exposure prophylaxis, or PEP, is a short course of ART that is taken to prevent HIV infection after a potential exposure. PEP is most effective when initiated as soon as possible after exposure, ideally within 72 hours, and is recommended for individuals who have had a significant risk of HIV exposure, such as having unprotected sex with someone who is living with HIV or whose HIV status is unknown, or sharing needles or syringes used to inject drugs with someone who is living with HIV or whose HIV status is unknown. PEP is not a foolproof method of preventing HIV infection, but it can significantly reduce the risk of acquiring the virus when taken correctly and within the recommended time frame. The sooner PEP is initiated after a potential exposure, the higher the likelihood of preventing infection. PEP typically involves taking a combination of 3 antiretroviral drugs for 28 days. The specific drugs used may vary depending on the individual's risk factors and the potential source of exposure. It is essential to complete the full course of PEP as prescribed, even if side effects occur, to maximize its effectiveness. PEP is an important tool in the fight against HIV, providing a critical window of opportunity to prevent infection after a potential exposure. However, it is not a substitute for consistent condom use, practicing safe injection drug use, or other preventative measures. Diagnosing HIV early in the course of infection is paramount for several reasons. Primarily, it allows individuals to access life-saving treatment with antiretroviral therapy, or ART, sooner, significantly improving their long-term health outcomes. Early ART initiation helps preserve immune function, preventing the progression to AIDS, and reduces the risk of transmitting the virus to others. The cornerstone of HIV diagnosis is the detection of specific antibodies produced by the immune system in response to HIV infection. These antibodies typically appear within a few weeks of exposure, but it can take up to 3 months for them to reach detectable levels. This period, known as the window period, is crucial to consider when interpreting HIV test results. Several types of HIV antibody tests are available, each with its advantages and limitations. Rapid HIV tests, as the name suggests, provide results within minutes, making them ideal for point-of-care testing and outreach programs. These tests typically involve a simple finger prick blood sample and can detect HIV antibodies as early as 2 weeks after exposure. For more definitive results, laboratory-based HIV antibody tests, such as enzyme immunoassays or EIAs, and chemiluminescence immunoassays or CELIAs are often used. These tests offer higher sensitivity and specificity than rapid tests and can detect HIV antibodies earlier in the course of infection. If an antibody test yields a positive result, it is crucial to confirm the diagnosis with a follow-up test, such as a Western blot or an HIV RNA test, to rule out false positive results. While HIV antibody tests are essential for diagnosing HIV infection, they provide limited information about the state of an individual's immune system or the level of active viral replication. To gain a more comprehensive understanding of the infection's progression and guide treatment decisions, healthcare providers rely on additional diagnostic tests. One such test is the CD4+ T cell count, which measures the number of CD4+ T cells, also known as helper T cells, in a sample of blood. As HIV specifically targets and destroys these vital immune cells, the CD4+ T cell count serves as a crucial indicator of immune function. A healthy individual typically has a CD4+ T cell count between 500 and 1,500 cells per cubic millimeter of blood. As HIV infection progresses, the CD4+ T cell count gradually declines, reflecting the ongoing damage to the immune system. Regular monitoring of CD4+ T cell counts helps healthcare providers assess the severity of the infection, predict the risk of opportunistic infections, and tailor treatment accordingly. Another critical diagnostic test is the HIV viral load test, which measures the amount of HIV RNA in a sample of blood. Viral load reflects the level of active viral replication in the body. A higher viral load indicates more active viral replication and a greater risk of transmitting the virus to others. Monitoring viral load is essential for assessing the effectiveness of ART and identifying potential drug resistance. Nursing care for individuals diagnosed with HIV extends far beyond the administration of medications. It necessitates a holistic approach that addresses the physical, emotional, and psychosocial needs of the patient. The initial encounter with a newly diagnosed individual is particularly crucial. It sets the stage for building rapport, establishing trust, and fostering open communication, which are essential for long-term adherence to treatment and overall well-being. A comprehensive assessment forms the cornerstone of effective nursing care. This involves taking a detailed medical history, including any pre-existing conditions, allergies, and current medications. Equally important is understanding the patient's social context, including their support system, living situation, and any potential barriers to accessing healthcare. Inquire about their understanding of HIV, any misconceptions they might hold, and their emotional state following the diagnosis. Education is paramount. Provide clear, accurate, and compassionate information about HIV, addressing any questions or concerns the patient may have. Explain the importance of adhering to ART, the potential side effects of the medications, and strategies for managing them effectively. Discuss safer sex practices, including condom use, and the importance of disclosing their HIV status to sexual partners. Addressing the emotional and psychological impact of an HIV diagnosis is crucial. Be empathetic and non-judgmental, providing a safe space for the patient to express their fears, anxieties, and concerns. Offer information about support groups, counseling services, and other resources that can provide emotional support and guidance. Remember, a positive and supportive nurse-patient relationship can significantly impact the patient's journey with HIV. Nursing care for individuals living with HIV is an ongoing process that extends beyond the initial diagnosis. Regular follow-up appointments are crucial for monitoring the patient's physical health, assessing treatment effectiveness, and providing ongoing education and support. During these visits, closely monitor the patient's CD4+ T cell count and viral load, which provide essential insights into their immune status and the effectiveness of their RT regimen. Be vigilant for any signs or symptoms of opportunistic infections, such as persistent fever, unexplained weight loss, persistent diarrhea, or skin lesions. Prompt recognition and treatment of these infections are crucial for preventing serious complications. Medication adherence is a cornerstone of successful HIV management. Regularly assess the patient's adherence to their RT regimen, addressing any barriers they may face, such as side effects, pill burden, or difficulty remembering to take their medications as prescribed. Provide education about the importance of adherence and strategies for improving medication adherence, such as using pill organizers, setting reminders, or involving family members or friends in their care. Living with HIV can be emotionally and socially challenging. Provide ongoing emotional support, counseling, and referrals to community resources to help patients cope with the stigma associated with HIV, navigate disclosure to loved ones, and maintain a positive quality of life. Encourage open communication and address any fears or concerns the patient may have throughout their journey with HIV. Remember, compassionate and holistic nursing care plays a vital role in supporting the physical and emotional well-being of individuals living with HIV. Preventing HIV transmission is a multifaceted endeavor that requires a combination of individual behavior change, public health interventions, and addressing systemic inequalities that fuel the epidemic. Education plays a pivotal role in empowering individuals to make informed decisions about their sexual health and reduce their risk of acquiring or transmitting HIV. Promoting safer sex practices is paramount. This includes consistent and correct condom use for all acts of sexual intercourse, as condoms provide a highly effective barrier against HIV and other sexually transmitted infections. Openly discussing sexual health with partners, getting tested regularly for HIV and other STIs, and limiting the number of sexual partners can significantly reduce the risk of HIV transmission. For individuals at high risk of HIV exposure, such as those with multiple sexual partners or those who inject drugs, pre-exposure prophylaxis, or PrEP, offers a powerful preventative tool. PrEP involves taking a daily medication containing antiretroviral drugs similar to those used in ART to prevent HIV infection. When taken consistently as prescribed, PrEP can reduce the risk of acquiring HIV through sex by more than 90%. Addressing the opioid epidemic and promoting safer injection practices are crucial for curbing HIV transmission among people who inject drugs. Harm reduction strategies such as needle exchange programs provide access to sterile injection equipment, reducing the likelihood of sharing needles and spreading HIV and other bloodborne infections. Additionally, expanding access to opioid agonist therapy, such as methadone or buprenorphine, can help individuals reduce or eliminate their drug use, further minimizing their risk of HIV exposure. Stigma remains a pervasive barrier to HIV prevention, testing, and treatment. The fear of discrimination, rejection, and social isolation prevents many individuals from seeking testing, disclosing their HIV status, and accessing the care they need. Combating HIV stigma is not only a moral imperative but also a public health necessity. Education is key to dismantling harmful stereotypes and misconceptions about HIV transmission. It's crucial to emphasize that HIV is not spread through casual contact, such as hugging, sharing utensils, or using the same restroom. Promote accurate information about HIV transmission routes and dispel myths that perpetuate fear and discrimination. Treat all individuals living with HIV with dignity, respect, and compassion. Maintain patient confidentiality and ensure their privacy is protected at all times. Create a safe and welcoming environment where individuals feel comfortable disclosing their HIV status and discussing their concerns openly without fear of judgment. Advocate for policies and programs that promote HIV testing, prevention, and treatment access for all. Address social determinants of health, such as poverty, homelessness, and lack of access to health care, that disproportionately impact marginalized communities and fuel the HIV epidemic. Remember, ending the HIV epidemic requires a multi-sectoral approach that addresses both the biological and social factors that contribute to its spread. Navigating the complexities of the immune system and HIV is no small feat, yet it's a vital journey for aspiring nurses. This comprehensive guide has equipped you with a solid foundation in both areas, from the fundamental principles of innate and adaptive immunity to the intricacies of HIV pathophysiology and the nuances of patient care. As you prepare for the NCLEX-RN exam, remember that knowledge is your most powerful tool. Mastering the different stages of HIV infection, understanding the mechanisms of various ART drug classes, and recognizing the importance of medication adherence are crucial for providing competent and compassionate care to individuals living with HIV. Remember that behind every diagnosis is a person deserving of empathy, respect, and unwavering support. As you step into your nursing career, carry with you the understanding that HIV care extends beyond the clinical realm. It requires addressing the social, emotional, and psychological needs of individuals living with HIV. Be a pillar of support, a source of accurate information, and an advocate for reducing stigma and promoting access to quality healthcare for all. Embrace the ever-evolving landscape of HIV management, staying abreast of the latest advancements in treatment and prevention strategies. Your dedication to lifelong learning will not only benefit your patients, but also empower you to make a meaningful difference in the fight against HIV/AIDS. Remember, your journey as a nurse is one of continuous growth, compassion, and unwavering commitment to improving the lives of others.